So I got a question about having constant low back pain after having an epidural post-childbirth. So this is not uncommon at all. When a woman goes in for an epidural during childbirth, the spine has to be flexed really hard, meaning the patient has to be bent forward extremely hard, because if this is the spine and these are the spinous processes, they're normally kind of close. But what happens is the doctor or the anesthesiologist has to get in between here. So what they'll do is they're going to bend the patient forward and flex the spine so that the sinuses open up in the back. And what that's going to allow the surgeon to do, or the anesthesiologist to do, is insert their needle between the spinous processes and get all the way in so they can poke that dural sac and inject the anesthetic. Unfortunately, a lot of times women, when they're having this procedure done, already have pre-existing spinal injuries in that area that maybe aren't symptomatic. They're not feeling it, but they're there. And then when the doctor flexes them real hard, it actually causes more damage, and then the disc will swell and cause symptoms. Or sometimes the forces are so hard that it just causes damage on its own. Prior to being a chiropractor, I actually was an EMT and worked in the emergency room and assisted in several of these lumbar punctures or epidural type procedures. And the forces involved to try to get some people to have enough flexion can be quite severe. So I know firsthand the forces involved, and it is enough to cause spinal damage. But the good news is these problems can easily be addressed by a good Gonstead chiropractor. The patient has to be checked, some x-rays should be taken to know exactly where the problem is and the best way to correct it. But if you're having constant back pain after having epidural, find a good Gonstead chiropractor in your area and they will take care of you.